Hello, everyone. I will be giving my change proposal for my current job, Overlake Hospital in Bellevue, and I will be talking about two specific organizational issues that I have observed and the solutions I would implement to change them. The first organizational issue I have observed is with the acquisition and integration of the Belgrove outpatient OBGYN clinic into the Overlake system. This occurred in December of 2021, and the issues lasted about until June 2022. I know this issue existed because of the increased workload as an ultrasound technician. Some symptoms of the problem included ineffective communication between management and the ultrasound department, as well as with schedulers, and between both Overlake and OBGYN clinic. Also, the new procedures and protocols that needed to be smoothly adjusted, and patient confusion due to the switching into a new hospital system. Now, for the first problem, which was the integration of the OBGYN clinic into the Overlake system, I believe that issue is somewhat significant. As an ultrasound technician, I observed that it increased the patient load on our department, as well as slowing down the workflow that we had to incorporate their patients and exams into our daily schedule on top of our pre-scheduled patients, our emergency department, and any other orders given throughout the entire hospital. I believe the organizational structure was impacted because it was not quite prepared to handle the acquisition, and we had to experience adjustments and come up with new ways to integrate them smoothly and how we would handle patient influences. Many of them got sent to our outpatient Issaquah and Redmond clinics. We also experienced an overflow in the main Overlake campus hospital. As well as with the acquisition, there was a change in management, and having to bring on to new providers and new nurses into our system and get them used to the organizational culture and prepared to transfer their pre-patient care to ours and for us to accept any patient medical records and understand what information they had to give us. My proposed change for the first problem with the integration of the OBGYN clinic is to create a forum for communication, one for employees and one for patients, as well as improving the scheduling methods that were involved. I would use the Cotter 8-step change model. For the first organizational issue, I would implement change using the Cotter 8-step change model. Now, this is very similar to Lewin's change model in that those steps 1 through 4 are for the unfreeze phase, steps 5 through 7 equate to the change phase, and step 8 is equivalent to the refreeze phase. Now, step 1 is creating a sense of urgency for change. Now, this was not necessary in the acquisition of the OBGYN clinic because it was a premeditated decision and we just had to move forward with it and figure out how to implement the smooth transition. The second and third step are to create, the second step is to create a form of guiding coalition. Now, I feel like this was lacking and would have aided in the smoother transition. I would have liked to have seen someone from our ultrasound department, as well as someone from the scheduling and someone from the OBGYN clinic, all working on a team together to problem solve and discuss ways to make it a smooth transition, changing and coming up with procedures that would be standard across all 3 departments, and then letting that information trickle down to everyone else. The third and fourth step are to develop and communicate a vision. In this case, it would have been a smooth integration of the OBGYN clinic's patients, providers, and nurses into the Overlake system. The fifth step is to empower action from others, in this case being encouragement to problem solve. And for this, I would have used a online forum for questions, one for employees and one for patients. On my end as an employee, I experienced many emails going back and forth about how we should handle patient flow, where we should send patients to either outpatient clinics or to the main campus. And I assumed there was many questions from patients as well. And it would have been nice to have somewhere a central database where they could go and ask questions and get resources in order to educate themselves and problem solve. The next step would be to create short-term wins. And in this case, it would be to find solutions that work. And in this example, if we used a question forum, showing the progress that that is giving and the results, and if patient satisfaction is going up or down with that, and how to further implement that. The last step would be to institutionalize these new procedures. For us, it took about 6 months before we finally got a somewhat concrete system going on how we would integrate their patients, the new patient medical records and everything, and putting their new providers and nurses and making sure everyone was on the same page. The second organizational issue I observed is increased patient volumes in the emergency room. Now, this has been going on for the last few years, but I'd say especially occurred during COVID and then the aftermath of COVID, evidenced by longer wait times, upwards of 5 to 6 hours and even up to 10, and then slower workflow with the ER and taking longer to triage patients, to see patients, and to discharge them home. And with an increase in patient complaints and many of them leaving before being seen because they just don't want to wait for 10 hours. Now, this data is from the Washington State Health Department quarterly reports, which is accessible to the public, and it shows overall emergency department visits at Overlake in the last several years. You can see it steadily climbed from 2017 to 2019, and then it dramatically dropped in 2020, which was the peak of COVID, and many people were in quarantine and did not visit the hospital. And then since it has climbed steadily back up to normal levels in 2021. Now the data wasn't completely out for the fourth quarter of 2022, so that I did not put on here. But you can see it has steadily been increasing throughout the last several years. The second organizational issue being the increased emergency visits in the ER, I believe was very significant. Much of it was impacted due to the external environment being COVID pandemic, and the organizational design of the ER was not prepared to handle the increased volume that we saw during the pandemic. That happened to cause increased interpersonal conflict between departments, being, for me, ultrasound and the ER, as well as in between teams in the ER, nurses and providers and front registration staff, as well as in between patients and the ER itself. A lot of that was partially due to the lack of staffing and the high turnover during the pandemic of people burning out and not willing or wanting to handle an impact that it caused on our environment, and then the lack of resources to handle COVID patients and to triage and treat people on top of all of the pandemic increase as well. I would use a new vertical triage process, hire more staff in the ER, and increase advertisements to patients explaining the change in our environment and resources that they can use to educate themselves. I would use Lewin's change model for this form. I would use Lewin's change model. Now, according to Borkowski and Mies, there are 3 phases: unfreeze, change, and refreeze. And for the unfreeze phase, you need to prepare employees for change. For this, it was very hard in the fact that the pandemic came unannounced and many were unprepared for it. So it was really hard to prepare people for that kind of change. But in the smaller view, for changing around how we would handle it in the ER, I would have liked to have seen more communication about new procedures, between the ER staff, providers, nurses, as well as the Overlake campus as a whole, including our radiology departments. And then implementing the change, it would be nice to train the new staff in the triaging procedures and how they would round on the patients, when to check in on them, where in the lobby they should go, and how fast or like how the system of vertical triaging would work and what nurses would be assigned that position, as well as going over the new design of the lobby. In this case, Overlake designated a private sector of the lobby in a corner where patients could sit in recliners and more comfortable chairs and not just wheelchairs, and that they would have a designated sign that says vertical triage, where they would be established they had already been triaged by nurses and tests were ordered, and they would be separate from everyone else waiting in the ER. The last step would be to refreeze, which was communicate the support for management and advertise these new practices to patients. Now, this took a long time for patients to get used to the vertical triaging system and understanding who should sit where and what would happen if they got pulled back and not immediately being given a room, but just being able to get triaged, get their vitals done, get tests ordered, so that they didn't have to wait for all of that to occur until they got a room. And also the continuing monitoring and adjustment of procedures. We did several adjustments. It took several weeks for us to decide, okay, this would work, okay, that wouldn't work, maybe we should put patients here. And in this system, we used questionnaires from patients. We got many complaints, some of which being no privacy in the ER, not feeling checked on. And so they would send out emails and be like, okay, we want you to round on patients every hour if you can. Make sure they're sitting in the right private section in the ER for the vertical patients. And just try to offer them water or a warm blanket when you can, and that will increase their satisfaction, which in my experience, it did work. To conclude, the two organizational issues I observed were trouble with integrating the Belle Grove OBGYN clinic into the Overlake system and an increased patient volume in the emergency room. I used the Lewin's change model and Potter's 8-step change model to solve these issues, which are both very similar, and the solutions being to improve communication and scheduling in the ultrasound department to smoothly transition the OBGYN patients into our system, and to employ a vertical triage process and new staff training to handle the increased volume and workflow. Thank you for viewing my project, and I hope you learned something new. And here's a list of my references.